We will be handing out these small little flyers, English and Spanish.
Volunteers with Chelsea's nonprofit La Colaborativa are preparing to hit the streets.
We have made available some gloves.
They're going door to door in a city deeply scarred by COVID to remind people they still need to take precautions and convince them to get vaccines. Longtime volunteer Dr. Julia Kohler lays out questions they might get.
Am I going to be infertile? The answer is no. Is there a chip in the vaccine that will locate me in the future? Can ICE find me and with that chip?
This organization has deep roots in a community that's nearly half immigrants. And their food pantry, started a year ago, has fed thousands of people a week. But recently, phone lines here have been flooded with calls about the vaccine. Chelsea's no longer considered a COVID red zone, but there's reason to be wary. The city still has some of the highest rates of COVID in the state relative to the size of its population.
Until when are we going to be out of the red zone? Because it means that people get too laid back. It means that we're going to sort of like get the guard down.
And so they're still working flat out.
Mira, yo tengo aquí máscaras nuevas.
In the neighborhoods, masks are handed out.
This is free.
Sí.
And volunteers hear a sampling of attitudes about the vaccine. This woman, who didn't want to give her name, says she's too nervous.
After what I heard about the vaccine, no, I just don't plan on taking it.
La gente, yo creo de que no se aplica la vacuna.
Chelsea resident Edwin Guandique told me people are worried about side effects.
Pues estoy esperando un tiempo más.
And he wants to wait because he believes the vaccine will be improved over time.
Yo sé que esta enfermedad anda muy fuerte y yo necesitaba la vacuna.
68-year-old Maria Perez knew she needed to get the vaccine. She brushed aside myths she'd heard, but struggled with busy phone lines until a friend took her to the community vaccine clinic in downtown Chelsea. The clinic's a sign of hard-won progress, a partnership between La Colaborativa and the East Boston Neighborhood Health Center. But there's still a lack of trust in both healthcare providers and the government.
I know things have changed in D.C., but that doesn't necessarily mean that it's changed for these individuals. And what they've heard over the past few years in terms of public charge and deportation and things like that, and I think that still resonates today with many of the residents of Chelsea.
And like everywhere, virus fatigue is setting in. Dr. Kohler is urging people not only to get the vaccine, but to keep wearing masks, keep social distancing. She's worried virus mutations could bring another wave. And if the state opens up too quickly, she says, a city like Chelsea could again bear the brunt. Liz Neisloss, GBH News.